Hello and welcome back to InterpreterPrep.com. This is our second presentation on the digestive system. We'll be continuing our journey down the digestive tract where we left off at the mouth in part 1. Today we'll be talking about the pharynx, the esophagus, and the stomach. Now, back in part 1, the spaghetti had been chewed by the teeth, then mixed with saliva, becoming the bolus, seen here in green in the top image, and then along comes the tongue and pushes the bolus back into the throat to be swallowed. When swallowing, the soft palate goes up, blocking off the nasopharynx so that the bolus goes down your throat and not up into your nose. Now, if you put your fingers on the front of your neck and swallow, you'll notice that something moves up. That's your voice box, also known as the larynx. When the larynx goes up, it comes in contact with a flap of cartilage called the epiglottis, sealing the glottis, which is the entrance to the windpipe, also known as trachea, to keep the food or liquid out when we swallow. So now we know that when we swallow, the soft palate blocks access to the nasopharynx, and the epiglottis blocks access to the windpipe. Once the bolus hits the pharynx, waves of muscle contractions called peristalsis push the bolus down the esophagus. On the lower left side of the image, we can see the bolus in green going down the esophagus. We see how the muscle above the bolus contracts, pushing the bolus down, while the muscles below the bolus relax, and this is how that peristaltic wave nudges it down into the stomach as seen on the bottom right. All this that we've talked about, putting food in your mouth, chewing, and swallowing, is known as ingestion. It's the only part of the digestive process that is under our control. Once you swallow, the rest is on autopilot. Isn't it great that we don't have to think about all these things that our bodies do for us? Okay, now let's talk a little bit more about the esophagus. The esophagus is a muscular tube that receives the bolus from the pharynx and takes it down to the stomach. The inside of this muscular tube is called the lumen. The inside of the stomach and intestines is also called lumen. From now on, instead of saying the inside of, I'll just say lumen. The lumen of the esophagus is covered by mucous membrane. As we see in this image, the esophagus, seen in red, is located in the back part of the thorax, descending in front of the vertebral spine, in between the lungs, and behind the heart. The heart was removed in this image to make the esophagus visible. Either that or this is the body of a heartless person. Before connecting to the stomach, the esophagus passes through a thin, dome-shaped muscle called the diaphragm, which separates the abdomen from the thorax. The point where the esophagus meets the stomach is known as the cardiac sphincter, also known as the lower esophageal sphincter. As we see here on the top right, the cardiac sphincter acts as a valve, keeping the acid in the stomach. When it malfunctions, the acid in the stomach spills up into the esophagus, as we see in the bottom right, signaled by the red arrow going up. An acid reflux occurs. This condition is known as gastric reflux, and also commonly known as GERD. We are now at the stomach. They say that the way to a man's heart is through his stomach, and maybe that's why they called it the cardiac sphincter. I guess we'll never know, but what I can tell you is that the stomach is located in the left upper quadrant of the abdomen, and we see it in red in this image. So, The bolus is now in a chamber full of acid, which is the stomach. The hydrochloric acid in the stomach is so corrosive that the cells that make up the stomach's lining are constantly shed and replaced by new ones every 3 days, which means that every 3 days we have a completely new stomach lining because the acid ate it away. There's also pepsin in the stomach, an enzyme that breaks down protein. The stomach is all wrinkled inside. These wrinkles are called rugae, which help the stomach expand when the food arrives and play an essential role in a hot dog eating contest. How else can someone eat 50 hot dogs in 10 minutes? And we can divide the stomach into 3 parts. First we have the fundus, which is its hat or top part. Then we have the body, which is its central part and which curves to the right. And then we have the pylorus, also known as the gastric antrum, which is where the stomach narrows down and the duodenum begins. The point where the stomach ends is marked by a muscular ring called the pyloric sphincter, which regulates the passage of the partially digested food, now called chyme, from the stomach to the duodenum. The stomach's function is to hold the food, start breaking it down, and deliver it to the duodenum a little bit at a time so that the intestine's job of absorbing it is easier. Now let's go over some signs and symptoms of disease. A patient can come in complaining of abdominal pain, heartburn, difficulty swallowing, bad breath, regurgitation, which is a vinegary-like taste in the mouth, nausea, vomiting, indigestion, which is a feeling of sluggish emptying of the stomach like you ate and the food just sits there forever, or GI bleeding, which may be evidenced by vomiting blood, known as hematemesis in medicine, or dark tarry stools, known as melena in medicine. Now let's go over some of the diseases of the upper GI tract. First we have achalasia. Achalasia is a decreased mobility of the lower half of the esophagus, which also dilates a lot. It's of unknown cause. However, patients from South America may develop this as part of Chagas disease, which is caused by a parasite, but not frequently seen here in the US. Then we have esophageal varices. These are dilated veins which appear or are found at the end of the esophagus due to congestion. They're frequently seen in alcoholics. Another is esophageal cancer. Esophageal cancer is related to drinking very hot liquids and to chronic GERD. Barrett's esophagus implies the presence of changes in the lower part of the lining of the esophagus due to a chronic inflammation. It is a risk factor for the development of esophageal cancer. Then we have GERD, which is a disorder of the cardiac sphincter, causing acid reflux into the esophagus. GERD stands for gastroesophageal reflux disease. Then we have hiatal hernia. When you hear the term hernia, it always means that something's out of place. In this case, a part of the stomach is poking up through the hole normally used by the esophagus to reach the stomach. The left side of the image shows a stomach in its normal position, and the right side a hiatal hernia. This condition predisposes to gastric reflux occurring. Then we have gastritis. This image is great to look at while we talk about the next 3 disorders. Gastritis is the inflammation of the lining of the stomach, which we see here as a red spot. Stomach cancer. This is a tough one to diagnose early. Cancer means, if I didn't explain it before, that the cells are dividing too fast and growing wildly out of control. Stomach cancer may not give any symptoms in the beginning since there's a lot of place for the tumor to grow, sometimes detected by a chronic anemia that appears on lab workup, which is due to blood loss from the stomach. Then we have gastric ulcer, also known as peptic ulcer. To say it simply, an ulcer is a wound in the lining of the stomach similar to one you'd get if you were riding a bike and fell on the pavement, scraping your elbow. The difference here is that the acid is what's scraping the lining of the stomach. Ulcers are associated with infection of the stomach by a bacteria called H. pylori, and also associated with the use of alcohol and NSAIDs like ibuprofen, if taken chronically for a long time. If untreated, the ulcer can deepen and perforate the wall of the stomach, giving way to peritonitis. And peritonitis is the inflammation of the peritoneum, which is a membrane that covers most of the abdominal organs. Peritonitis can be caused by an infection, could be the case of a burst appendix, or can be chemical in nature, like we had just mentioned, a perforated ulcer with the spill of hydrochloric acid into the abdomen. Last but not least, we have the nutcracker esophagus, which causes chest pain and difficulty swallowing due to abnormal peristalsis. Now, let's talk about some of the diagnostic procedures used to diagnose some of the diseases of the upper GI tract. One is the barium swallow, which is a special kind of X-ray. It's also known as an esophagram. The patient is given a barium suspension to swallow, which coats the lumen of the esophagus, making the esophagus visible to X-rays. Then there's the upper GI series, also known as barium meal. As in the barium swallow, the patient is also given a barium suspension. This study permits the stomach and duodenum to also become visible on X-rays. It just takes longer because the radiologist has to wait for the barium suspension to reach and coat the stomach and duodenum. Then we have the esophageal manometry. This is a study used to measure the pressures inside the esophagus. Then we have upper endoscopy, also known as EGD, which stands for esophagogastroduodenoscopy. Nobody says that. They all say EGD or upper endoscopy. Don't worry. It's used to see the esophagus, the stomach, and the duodenum through the use of a fiber optic endoscope. An endoscope is a thin tube with a light and a camera on its tip, and this procedure is generally done under anesthesia. Then we have the abdominal CAT scan. When you get a CAT scan, it's like going into a big donut hole. You can observe in that image. This machine makes images of the body that look like this. It's like when you take a baguette and slice it with a knife. The machine does the same. It produces images of slices of the human body, but fortunately without cutting anyone up. Then we have the abdominal MRI. This study obtains similar images as a CAT scan. It also differs from the CAT scan machine in that here the patient's whole body goes into the machine. There are, however, open MRIs for people who are claustrophobic. This gives many patients the impression that their whole body was MRI'd. We have some labs. A particular lab study that's done in gastroenterology is the H. pylori test, used to diagnose H. pylori infection in the stomach. Now let's talk about some of the treatments. We have the stomach protectors, which are medications used to protect the stomach by reducing the amount of acid it makes, like omeprazole and ranitidine. They're used to treat gastritis and ulcers. Then we have antacids. These medications neutralize the stomach acid. An example is Mylanta. There's a special tube that's used in emergency situations called the Blakemore tube. It's a special type of catheter introduced into the stomach. It has two balloons which are inflated once the tube is inside the esophagus and the stomach to put pressure on the bleeding gastroesophageal varices to stop or reduce the bleeding. This procedure is done in MICU, which means Medical Intensive Care Unit. Then we have certain surgical procedures like gastrectomy, which is the removal of the stomach totally or in part. It's used or done to treat complicated ulcers or cancer. Another one is vagotomy. In this surgical procedure, the nerves that make the stomach produce acid are cut or severed, and it's used to treat ulcers. Then we have what's known as fundoplication. Fundoplication is a surgical procedure used to treat hiatal hernias to avoid the acid reflux from occurring, where the fundus of the stomach is wrapped around the lower esophagus. Plicate means to fold. Then we have antibiotics that are given for H. pylori infections like amoxicillin and clarithromycin.